Now let's introduce this girl. She's gotten super pregnant and was walking by the No Psychos pine tree when she saw that huge centipede and reached out to touch it. I also want you to know that her pregnancy craving has been olive oil. So she was carrying a bottle around with her that she's been slowly drinking from. So when she reached to touch the centipede on the pine tree, a bunch of oil spilled out. This pine tree, again, is the symbol for the pine suffix of many atypical antipsychotics, such as acetylpine, represented by the centipede, clozapine, represented by the clothesline, quetiapine, the guy saying quiet, and olanzapine, which is the snowman. Recall that lots of oil like this is our symbol for hyperlipidemia. And this girl, who's gained so much weight due to her pregnancy cravings, represents weight gain. And also notice those dyed beads on her fancy coat. Those dyed beads represent diabetes. So tying this all together, the girl who gained lots of weight spilled her hyperlipid oil and wearing dyed beads next to this pine tree should help you remember that the atypical antipsychotics with the pine suffix can cause weight gain, diabetes, and hyperlipidemia. So now let's finally talk about some side effects that apply to all of the atypical antipsychotics. An old man is sitting next to a fire roasting a hare while he eats a Three Musketeers bar. Musketeer bars are the recurring symbol for muscarinic 3 receptors. So this guy eating the Three Musketeers bar should make you think of anti-muscarinic, or specifically blocking muscarinic 3 receptors. But the reality is, atypical antipsychotics can also block muscarinic 1 and muscarinic 2 receptors. In fact, as we mentioned before, he's roasting a rabbit. You could call it a hare, actually. And since it's burning, we think of hot. So hot as a hare. And hot as a hare is our symbol for that phrase, hot as a hare, dry as a bone, and mad as a hatter, which is a mnemonic that many people use to remember the anticholinergic effects. So the whole idea here is to remember that atypical antipsychotics can cause antimuscarinic or anticholinergic effects. As he enjoys his Three Musketeers bar and waits for his hare to finish roasting, the old man is looking at a brochure for a retirement community called Elderly Paradise Services, or EPS, that he's thinking about moving to. Well, EPS stands for Elderly Paradise, or Elderly Paradise Services, but it also stands for Extrapyramidal Symptoms, EPS. So this brochure the old man is holding should help you remember that atypical antipsychotics can produce extrapyramidal symptoms. It's worth noting that first generation or typical antipsychotics are actually more likely to produce these extrapyramidal symptoms, as well as the antimuscarinic symptoms, more so than second generation or atypical antipsychotics. A woman can be seen pinching her grandma's cheeks and stretching them out while saying, "What a cutie," as her grandma grimaces with discomfort. Not a respectful way to treat one's elderly family members. You may recall that someone saying cutie while stretching their cheeks represents QT prolongation. So this should help you remember that all atypical antipsychotics can cause QT prolongation. Now this evil villain Maleficent has been cast out of her old